Hello and welcome to all of you. My name is Angelika Zollfrank. I am a certified ACPE educator and I'm a manager in the Department of Spiritual Care at Yale New Haven Hospital. I'd like to spend some time today to talk with you about CPE group theories. Group theories in CPE are important to think about because we understand CPE as group education. And group education intentionally makes use of the small group as one primary learning tool. So educators are required to articulate how people learn in groups, what theory of group dynamics informs supervision in education, and why a group model of education contributes to achieving the CPE outcomes. So ideally, everything we do in CPE is intentional and is designed to help students achieve CPE outcomes. The CPE outcomes, both level 1 and level 2, are addressed in the CPE group. One could make an argument that all outcomes are addressed in the group. However, there are certain CPE outcomes in level 2 and level 1 that are more intentional or specific about how they pertain to a CPE group learning. So there are 3 level 1 and 3 level 2 outcomes that are particularly pertinent. In level 2, it's the outcome 311.3, which talks about students being able to initiate peer group and supervisory consultation and the ability to receive critique about one's ministry practice. The second pertinent level 1 outcome is 311.4, risk of offering appropriate and timely critique with peers and supervisors. And the third one is 311.5, recognize relational dynamics within group contexts. Now let's look at level 2. In level 2 outcomes, there are again several outcomes that speak specifically about learning that can take place in the CPE group. The first one is 312.4, assess the strengths and needs of those served, grounded in theology and using an understanding of the behavioral sciences. Behavioral sciences is a rather vague term, but I would count group theory among that. The second outcome is 312.6, demonstrate competent use of self in ministry, which we understand to include emotional availability, cultural humility, appropriate self-disclosure, positive use of power and authority, a non-anxious and non-judgmental presence, and clear and responsible boundaries. 312.7 speaks to a student's ability to establish collaboration and dialogue with peers, authorities, and other professionals. The CPE outcomes, level 1 and level 2, are within the world of ACPE very important. However, CPE is not only professional education for ministry and as such a part of theological education, it also prepares students to become eligible for board certification. So we need to keep an eye on the common qualifications and competencies for professional chaplains. And the Association for Professional Chaplaincy has those qualifications and competencies published on their website. So for certified educators, this means that the CPE group theory will need to articulate how it usefully facilitates students' growth towards the achievement of those common competencies for professional chaplains. And that is important to keep in mind as you're thinking about your group theory and as you're thinking about how you might intentionally help students to achieve those qualifications and competencies. I'm going to run through the list of qualifications for professional chaplains that are addressed in CPE group work. And you will see that they're fairly specific. And one thing to note is that the common qualifications and competencies are less focused on the student and more focused on the outcomes and the functioning in a professional setting and in ministry. So the ones that apply specifically to CPE group work are ITP 5, articulate a conceptual understanding of group dynamics and organizational behavior. So we need to have in mind not only the CPE group and group dynamics, but also how those group dynamics help us to learn about organizational behavior. Second one is PIC 1, to be self-reflective, including identifying one's professional strengths and limitations in the provision of care. PIC 4 speaks to function in a way that respects the physical, emotional, cultural, and spiritual boundaries of others. That can be practiced in a CPE group. PIC 8 addresses the competence of communicating effectively orally. PPS 2 addresses the ability to provide effective spiritual support that contributes to the well-being of families and staff, which sometimes is ministry to groups. And then PPS 9 is the ability to facilitate group processes, such as family meetings, post-trauma, staff debriefing, and support groups. And lastly, OL3, understand and function within the institutional culture and systems, including practices, the ability to practice appropriate ways of being in the world in one's role in the organization. So one question to ask as you're thinking about your group theory is, are you talking about the here and now, and why is that important in CPE group settings? Are you trying to help students to be in the here and now? And how are you helping them to unpack the baggage of their past to make useful applications in their spiritual care practice? So that's just one of the many questions to ask. I want to run through a couple of other questions that you might want to think about as you're developing your group theory and as you're working with groups. I have my own group theory, and this presentation is really designed to help you develop some of your own answers to the same questions that any group theory in CPE needs to address. So I will run through the questions and I will give some examples that come necessarily from my group theory that I'm using that may not be yours, but the answers to the question need to be part of your theory. So the first one in my mind is that you spend some time on thinking on what are the norms, the boundaries, and the structure of the CPE group. And are those norms, boundaries, and structures set up and given to the group by the certified educator, or does the group have input in that? Those are not unimportant questions. So for me, my predominant group theory is system centers training, which was developed by Yvonne Agazarian. And there are clear norms about how to relate and communicate in the group. One of the norms is functional subgrouping. The boundaries are very clearly set, and the structure of the group includes time for process group, and I'm now thinking particularly about the process group. There's also at the end some time for surprises, learnings, satisfactions, dissatisfactions, and a time for a force field that looks at what were driving forces and what were barriers towards the group work in that time. The second question you want to address is whether the group theory that you're using is different or the same in different contexts. In other words, Most people, when they're thinking about a group theory in CPE, think about what I call small process group, or what is sometimes called interpersonal relationship groups. I would encourage you to think a little bit about whether your group theory also applies to other contexts like didactics, verbatim seminars, experience of faith seminars, preaching seminars, any other seminars that you offer in your CPE program. For me, yes, my group theory would apply to different contexts as well. How are the goals of group sessions defined? Depending on whether content or process is the focus. So in CPE, we have some program elements that are a little bit more focused on content, although we're overall very heavy on process. So the question that you want to ask yourself is, which context or which group sessions are more predominantly focused on content or more predominantly focused on process? You want to ask yourself, what is the articulated framework of the phases of group development? And you want to be sure that you don't just name those phases of group development, but that you can demonstrate how your understanding of the group development impacts on the interventions that you might offer as a certified educator. How does the group's and the individual's development relate to one another? This is not an unimportant question. You may want to ask yourself in selecting students for a program, how the individuals and what they bring to the group might help the whole group to grow, or also what might block the whole group from growing. You might think about those questions also more in detail. For example, for me, in system-centered theory, the individual, the subgroup, and the group as a whole are different levels of a system hierarchy that are related and isomorphic. Now, you may answer all these questions differently from your theoretical background, but you want to think about those questions, and there are more. How does what happens in the group apply to clinical work? This is a very important question if you want to keep in mind the outcomes of CPE and the common qualifications and competencies for chaplains. CPE groups are not therapy groups. They are important in terms of development of skills, possibly for clinical work. And you may want to spend some time in thinking about how what students do in the group will relate to their clinical functioning. Is the group process a place for emotional corrective or healing experiences? And we can think about that in different ways. Obviously, CPE groups are not therapy groups, they're educational groups. However, the argument could be made that education can be healing and emotionally corrective. For example, students who come into a CPE program may be highly anxious, for example, in thinking about their first on call, or they might be anxious about how they will be received. Those fears may create distorted thinking that actually needs to be tested out in reality. And in my own group theoretical background, there's a way of doing that. And you may see how people actually have emotionally corrective and healing experiences when they go through this process. You want to ask yourself if the process group is a context for skill building and educational experiences, and how so. In my own group work, I ask students to practice the skill of functional subgrouping, which is a hallmark of system-centered training. And that requires a particular skill of being able to reflect back what the last person has said, and to then build on that group input. So that's a kind of skill building that actually directly applies to the work at the bedside. How do issues in relationship to group members' own and the leader's authority get worked? So we think about the authority issue quite a bit in CPE because we think it's important for the formation of future leaders in religious communities and future chaplains. And you may want to think about the relationship of a group member's authority and the leader's authority, and how you think about those issues. Oftentimes, this is part of the phases of group development. In my own theory, and this is true for many group theories, the group starts out in flight and eventually may dabble a little bit in fight and possibly get a little bit beyond that. Now, groups go through the same cycles of stages of group development quite frequently, many times, to develop more and more and more. And in our CPE groups, we only have a very short time to work with people. So we need to be sure that we're not overloading our theory either, and at the same time keep the questions in mind. The last question that I'd encourage you to think about is what the role of experimentation or creativity in play is. Oftentimes, curiosity is a really important driving force for learning. And how might you help people in the group to have access to their curiosity, to their creativity, and their ability to experiment with new behaviors? How is what happens in the group process diagnostic of students or the educators' learning issues? So even experienced CPE educators may find that the group, if they're watching it closely and observing it closely, can give them clues about what their own growing edges are. And as you're thinking about your theory and as you're reflecting on your practice, I don't think that it's necessarily a weakness, but actually rather a strength in CPE to be able to also think about what you learn from your groups, even about your own limitations. That's a mature thing to do. You might also think about how what happens in the group process is diagnostic of the clinical rhombus and the educational environment. So in my own group theory, I've already talked about the hierarchies in the group, the individual, the subgroup, and the group as a whole. If you think about those levels of systems, you could think about Tupperware containers that are nested in one another. And in a way, the CPE group and the CPE program has an outer environment that holds it, which is usually the environment of the department, which helps to create the educational environment. So whatever goes on in a department will also in some ways affect the group and vice versa. So you may want to think about that as you're thinking about your group theory. Another important into developing your own group theory is that you think clearly about what you believe and what you're convinced the goal of a CPE process group should be. So now I'm zooming in particularly on the process group. And you want to write down what your goals are. So the answer to the questions that we just went through or reviewed will depend on your articulated goals for the CPE process group. So is your goal that people learn skills? Is your goal that students gain facility in relating across diverse traditions, cultural backgrounds, race, gender? So that's a kind of diversity training. Then if that's your goal, that will influence your group theory. Are you aiming to get your students to be able to reflect deeply on their theological and spiritual formation and on their foundations theologically? Are you thinking about spiritual direction in the CPE group? Would you like students to have an experience of intrapsychic personal development? Are you hoping to get your students to grow interpersonally? And would you like them to gain awareness of group as a whole dynamics? In some ways, the answer to that question is definitely yes, because that's part of the level 1 and level 2 outcomes, as well as the competencies in chaplaincy. Are you looking for students to develop the ability to observe stages of group development, which in some ways means that students need to be able to observe themselves and the group while being in it and participating in it? Are you hoping that students will be able to contribute thoughtfully to conflict resolution and transformation? And are you hoping that students will learn to build a work group? We need to think quite a bit in CPE group work about how we support the professional functioning of the CPE students that we're working with, because we are preparing them for professional contexts beyond CPE. So I'd like you to think for a moment about how you think about naming or calling the process group in CPE. There are several different names, and you may have heard them. There are more than I'm listing here. Interpersonal relationship groups, small process groups, open agenda groups. Those names already are telling of the theory that someone is using. So if I call the CPE small process group an interpersonal relationship group, then it is clear that I'm zooming in on the interpersonal relationships, not so much on the group as a whole. In small process group, one of the clear foci is the process of the group itself. In an open agenda group, it's very clear that the certified educator is not necessarily offering much of a structure or an agenda for that time. So you may want to think about how in your theory you call the CPE process group. As you're thinking about the goals of the CPE process group, you would then also think about the specific behaviors that you are hoping to observe in a CPE group. So depending on your goals, you would want to see specific behaviors in group members. You'd want to see particular theory-based leadership interventions, and those need to be intentional. You would want to observe individuals, interpersonal relationships, the group as a whole, or a subgroup, or a combination of any of those. So you need to be articulate about those particular behaviors. So your theory needs to be operationalized, and it needs to be something that people can, in the end, see on a videotape as connected to your group theory and translated and bridged into practice. So the goals of the CPE process group and the group members' behavior, as well as the leadership interventions, are interdependent. In other words, depending on your goals for the CPE process group, which need to be congruent with CPE outcomes and common competencies, you would choose one or more goals or one or several theorists as you're thinking about your group theory. And again, the purpose of this presentation is not so much to tell you about different group theories, but simply to think about goals, theorists, group behavior, and leadership interventions. Ultimately, the decision as to where you go with it will be yours, and group theories in CPE at the moment are quite eclectic, so you can draw on different resources. You, however, need to make a point of how those theories help you achieve the goals of the CPE process group, and as well as the CPE outcomes and competencies. So in the following slides, I want to offer some examples. They're by no means, completely exhaustive. There may be more. And those examples offer an overview to approaches to working with a few theorists and supervisory practices. So let's say your goal is to offer spiritual direction and spiritual care in the CPE process group. One of the theorists that I'm familiar with is Margaret Benefield, but there may be others. So probably you would want to engage the group in theological reflection, spiritual direction, and spiritual care of one another. The group behavior, then, one would expect that people are sharing personal beliefs, spiritual practices, spiritual care with one another, theological reflection, and that they might name conflicts between stated, received, and lived beliefs, and might point those out to one another. Leadership interventions might be facilitation, modeling, naming conflicts between stated, received, and lived beliefs. A second goal might be, or another goal that you might want to pursue in a CPE process group, is the increasingly authentic interpersonal relationships in CPE. That's a high value for many educators in CPE. Theorists who have stressed this are Paulo Freire, Martin Buber, and Irvin Yalom. And the goal would be spiritual and emotional caregiving, effective and authentic interpersonal relating. As group behaviors, you would hope to see giving and receiving of spiritual emotional care, sharing spiritual emotional needs, relating in the here and now, sharing insights about interpersonal relationships. And as leadership interventions, one would probably expect to see some modeling, norm setting, activating the here and now, support for group members in their work, sharing insights about interpersonal relationships, and facilitating group solutions to group problems. If your goal is diversity training in CPE, you might look to a theorist like Scott Page. And for him, the goal is right view, right intention, right speech, right action, right effort, and right mindfulness. Group behavior would be giving and receiving feedback, information sharing, both emotional and cognitive, growing self-awareness, and growing respect. Leadership interventions would be modeling, raising awareness, giving and receiving feedback, and pointing out increasing complexity in the group. If your goal is skill building in the CPE process group, and it may not be the only one goal, you may always land on several, you might turn to a theorist like Yvonne Agazarian and her system-centered theory. Skill building would include subgrouping, reflective listening, developing and observing self, and members contributing behaviors that are driving forces for the development of the group and its members. Group behaviors that you would want to see are members exploring experiences in the here and now, members asking anybody else, eye contact with subgroup and the group as a whole, spontaneous exploration, creative problem solving. And there are specific leadership interventions that aim at facilitating subgrouping, vectoring, meaning to actually allow the group energy to go into a particular direction, boundarying, setting some boundaries, and contextualizing. Those are specific SCT interventions, and if you want to learn more about those, you need to really read up on them. Another goal might be that you're working with the group as a whole, And the theorists who have done a lot of work in this area are Wilfried Bion and the Tavistock approach. And Bion is famous for his basic assumption work that he has seen in groups as a whole, where groups behave in a way that shows their basic assumption about the group or the leader. And those dynamics are unconscious. So the group behavior would be an acting out of basic assumptions in flight, fight, or pairing. We see this a lot as flight from the task in CPE. So you would see increasing ability to orient towards explicit goals. That would be what you would hope would happen as the leader intervenes with group as a whole interventions, as the group leader raises the awareness of basic assumption behaviors and reinforces the work on explicit goals. I'll leave you with this final cartoon, and I hope you found this presentation helpful as you think about and develop your own CPE group theory. Good luck with that. All right, Mark, I think we're done. Hello?